Hello everyone. Today we are going to learn about colostomy care. I am Minoli, tutor of Triple M College of Nursing. Let's see what are the objectives we are going to discuss in this session. For introduction about the colostomy care, what is ostomy and types of intestinal ostomies and purpose of bowel ostomies and colostomy, types of colostomy and trans articles required for the colostomy care, procedure and guidelines, and finally coming to the documentation. So final conclusions about the colostomy care. What is ostomy? An ostomy is a surgery to create an opening between an internal organ and the body surface. And coming to the types of the intestinal ostomies, one is a gastrostomy, jejunostomy, ileostomy, and colostomy. And gastrostomy means it is an opening through the abdominal wall into the stomach, and jejunostomy opens through the abdominal wall into the jejunum, and ileostomy opening the abdominal wall into the ileum, and colostomy which is opening the abdominal wall into the colon. Okay, so now we are going to see the purpose of the bowel ostomies. Purpose of bowel ostomies. First, to divert the bowel to an opening in the abdomen and to drain fecal material. Bowel diversion ostomies are classified according to their status or temporary or permanent, which is anatomic locations and constructions of the stoma. Colostomy. Colostomy is a surgical procedure that brings one and end of the large intestine out through the opening stoma, which is made in the abdominal wall, and tools moving through the intestine train through the stoma into the bag attached into the abdomen. Types of colostomy: loop colostomy, double barrel colostomy, ascending colostomy, and descending colostomy, and sigmoid colostomy. Transfer colostomy. The transfer colostomy is in the upper abdomen, either in the middle or towards in the right side of the body. This type of colostomy allows the stools to leave the body before it reach into the descending colon. Loop colostomy. The loop colostomy may look like one very large stoma, but it has two opening. Like one opening puts out stools, the other only puts out mucus. Double barrel colostomy. In a double barrel colostomy, the surgeon divides the bowels completely. Each opening is brought to the surface as a separate stoma. The two stomas may or may not be separated by skin, and one opening puts out a stool and the other put out only mucus. And the smaller stoma is called a mucus fistula. Coming to ascending colostomy. This ascending colostomy is placed on the right side of the belly. Only short portion of the colon remains active. This means the output is liquid and contains many digestive enzymes. A trainable pouch must be worn at all times, and the skin must be protected from the output. Descending and sigmoid colostomies. In this descending colon, the descending colostomy is placed on the lower left side of the belly. Most often, the output is firm and can be controlled. A sigmoid colostomy is most common type of colostomy. So, it is made in the sigmoid colon and located just a few inches lower than descending colostomy, which is because there more working colon, it may put out a solid stool on a more regular schedule. Both the descending and the sigmoid colostomies can have a double barrel or single barrel opening. The single barrel or in colostomy is more common. The stools of the descending or sigmoid colostomy is firmer than the stool of the transverse colostomy. Going for the permanent colostomy, if a patient is having the blackage, any injury, or colorectal cancer, or colonic polyps, or diverticulitis, and imperforated anus, or irritable bowel syndrome, or ulcerative colitis, so these kind of the patients can go for the permanent colostomies. Coming to the articles required for the colostomy care. So first, a clean tray containing is neat, and Macintosh with a draw sheet, and a kitty tray and paper bag, and pairs of clean gloves, and colostomy bag, and normal saline, and basin with a warm tap water, and gauze pieces, gauze pad, tissue paper, and skin barrier, and stoma measuring guide, and pen and pencil and scissors and bedpan. Coming to the procedure. So first to arrange all the necessary articles near to the bedside and explain the procedure to the patient and provide the privacy and assist the patient to a comfortable position and wash hands and wear gloves to prevent the contamination of infection and to spread the Macintosh under the patient and draw sheet to protect the linen material and to remove the clamp and empty the contents into the bedpan. Rinse the pouch with tepid water or normal saline to minimize the odor and growth of microbes. So once we have to check the old bag whether it is a 1 by 3rd of the fecal material, have to empty in the bedpan or the kidney tray. So after that, discard the disposable pouch in the paper bag and remove the used pouch and skin barrier gently by pushing the skin away from the barrier, and which will be reducing the trauma, jerking and irritation and skin and the causes of the tearing of the skin. Color and swelling and trauma and healing. Stoma should be moist and pink, which will be considered as a normal healthy wound. If it is any the discolorations like other yellowish color or brownish color, it will be infected wound. So which need some kind of ointment of the some treatment, and cover the stoma with the gauze pieces to prevent the fecal matters from the contacting with the other skin particles. So clean the stomal region gently with the warm tap water using the gauze pad. Do not scrub the skin dry completely by patting the skin with the gauze pieces, and remove the gauze and clean the stoma with the gauze and pat dry and measure the stoma using the measuring guide and to ensure accuracy in determining the correct pouch size needed. And after that, trace same circle behind the skin barrier using the scissors to cut and opening the 1 by 16th to 1 by 18th inches larger than stoma before removing the wrapper over adhesive part. Put the skin barrier and pouch over the stoma and gently press onto the skin for 1 to 2 minutes. To prevent irritation to skin, use the pouch if it is a drainable using a clamp or clip, and remove the gloves and wash hands and make the patient comfortable, and after that clean the area and replace all the articles. Coming to the guidelines. So first guidelines is keep odor as free as odor as possible. Ostomy bag should be emptied frequently and check the stoma regularly. The color should be dark pink and red and moist, which is considered as a healthy wound, and pale color indicates anemia. Dark and purple blue indicates compromised circulation. And other guidelines is like size of the stoma stable stabilize 6 to 8 weeks, and if dressing is frequently for drainage and bleeding, and keep the skin around the stoma like a peristomal area site clean and dry, and if not it causes skin irritation and infection. An intake and output chart must be recorded for every 4 hours and encourage the patient to participate in the care and to look at the ostomy things, and can help the patients by listening, explaining and being available and supportive. So after that, we have to encourage the patient to avoid some fiber rich diets and encourage the patient to drink fluids and educate the patient about the various methods of odor and control the measures. And chlorophyll rich diet will deteriorate the faces, so direct the contact sports and heavy lifting must be avoided. Coming to the type of the pouches, first one is the trainable pouch. The trainable pouches are generally used when the output will need to be trained frequently. Example, ileostomies. And the special trainable pouches with a tap outlet are used for urostomies. And then second one is one piece of the pouch. These pouches, as the name suggests, are all in one pieces. This whole thing is removed when the pouch is changed. And two pieces of the pouches, this one is available for all types of the stoma, have a separate base plate flank to which a pouch is fitted, and the space plate flags is left in the places on the abdomen with a new pouch fitted, and when necessary every 2 to 4 days the base of the plates flank will need to be changed too. And finally, coming to the documentation, record the procedure with the following details with the date and time and amount of the fecal material, color of the fecal material, and consistency of the fecal material in the pouch. So all they have to document. And thanks for watching. Keep subscribe to our channel.